Yeah, sounds interesting. And then we can move to the resistance training exercise prescription for type 2 diabetes, so actual prescriptions. So what are the key considerations that researchers and practitioners need to keep in mind when prescribing resistance training for individuals with type 2 diabetes?
Okay. I would say making sure that you are including an appropriate warm-up and an appropriate cool-down, number one. I know from my own experience with practitioners, I've attended a lot of gyms. I've been a member at a lot of gyms, including group personal training style gyms. And the warm-up is not always appropriate for what's actually being done in the exercise session. And for somebody without diabetes, I think one of the major concerns with that is a musculoskeletal issue, right? Hurting yourself. But when we're talking about people with type 2 diabetes, there's the musculoskeletal issue in addition to cardiovascular risks that could happen. So that would be the first thing. We also need to keep in mind that people with type 2 diabetes, they have a reduced exercise tolerance. So they may need more rest. We should be starting anybody off that's first starting off exercise slowly, moderately, and building from there. But this becomes even more important in people with type 2 diabetes. And this is also a reason that I think weightlifting is so great for people with type 2 diabetes, because they do have that opportunity to rest. Like with continuous aerobic training, it can be really challenging for people with this condition because of that reduced exercise tolerance. Another thing is with neuropathy. So sometimes with neuropathy, people with diabetes, they'll develop the foot ulcers and they get prescribed the rocker shoes. And with the rocker shoes, there are some data out there that shows that postural stability is affected by the rocker shoes. Even though I'm going to go into programming wanting my client to do as many standing free weight exercises as safely possible, that's probably not the best approach for somebody that is already struggling with balance, and now they're wearing shoes that might be affecting that balance further, and they need to keep the pressure off of the ulcer. So that's where the machine weights are quite helpful, is they can have a seat, they can still get the exercises in without putting any further pressure on that foot ulcer. Also, many people with type 2 diabetes have higher BMIs, so they're having to move more weight. So you can expect that they might not be able to do the same, like with body weight exercises. They might not be able to do these as easily starting off, and you'll have to take those things into consideration, as well as anatomical shape. Yeah, I think those are the main considerations I was thinking of.
Yeah, there's quite many and good ones. And then maybe you already replied part of this, but what are the most common mistakes and maybe misconceptions that you see when prescribing resistance exercise for type 2 diabetes patients?
One thing is something that we were already talking about, like that the rep ranges and the intensity, like with rep ranges consistently being prescribed at a higher rep range, lower intensity. But so maybe start considering some of the protocols using fewer reps and higher intensities, like even just between 6 to 8, because we are seeing some pretty profound effects in the research so far. And I'm not saying do that all the time, because there are different benefits, right? If we're doing the 8 to 12 rep ranges, you're going to have that hypertrophic effect. Drop it down a little bit in terms of rep ranges and increase the intensity, you're going to have more of a strength bias. So variety in programming is key to keeping people's interest. So there's nothing wrong with doing a few weeks at an 8 to 12 rep range, and then maybe a few weeks at a 6 to 8, and just bouncing back and forth between those two or other rep ranges. Another thing is maybe an overprescription of single joint movements. And I'm saying that because a lack of time is one of the primary barriers to any population, including type 2 diabetes, as why they don't exercise. I don't have the time to do it. And I remember when I was an undergrad and in an exercise prescription class, the recommendation was we have to have them doing between 8 to 10 exercises. That's quite a lot. And I don't think that it's absolutely necessary if you're doing primarily multi-joint movements. Because if you're doing a row, you're not only working your back, but you're also working your bicep. So I would say doing more multi-joint exercises, it's going to be more effective in terms of hitting more joints at once, hitting more muscle groups at once, greater greater neurological activity, greater hormonal response compared to single joint. Single joints do have their place, absolutely. I'm not saying that they don't, but I think a lot of times there's too many of them included that it just becomes fairly burdensome for the client in terms of time. And then the last thing that I was thinking of is related a bit to what I was saying earlier with having variety in the programming is important for keeping the interest of your client or your patient. But at the same time, if you do it too much, it doesn't give them the opportunity to develop mastery in the skills. And so part of adhering to a resistance training program is really developing that mastery, that self-efficacy, and knowing that you can do it. So I think having a good balance between focusing on one lift long enough to develop mastery, but also changing things up to keep them interested.
Yeah, that's a good point. And I think many times people forget the mastery from the kind of that it's a big motivating factor. Like it's very nice if you can do a nice squat or something. It's really nice and it's a good point. And if we talk about the different exercises, what exercises you would definitely include in the programs or prescriptions for patients with type 2 diabetes?
Okay. I'm probably going to elaborate on this a bit, but 2 primary exercises come to mind, and that is going to be some version of a squat. Now, I'm not saying necessarily if it's safe to do. I'm not necessarily saying get them out there and start doing a free weight squat right away, but any version of a squat. I'm talking about, and everybody should start off learning how to squat with just their body weight before they put any type of resistance on them other than their body weight. Air squats. If it's an older adult or somebody else with limited mobility, have them doing chair squats. And there's a lot of ways to adapt that to different levels of ability. Just because it's one of the most functional movements that we do in everyday life. When we sit down to get in a chair, when we stand up out of a chair, that's essentially a squat. And so I think the squat is going to carry over to a lot more everyday activities that we tend to do. And then the other one that I was thinking of is a lunge. And I'm thinking of a lunge because, once again, going back to the neuropathy, which is highly prevalent in people with type 2 diabetes, so you lose balance. And one of the ways that you help to increase your balance is by doing lower body and core strength exercises, especially when they're unilateral standing leg exercises. So when you're taking one step forward and having to balance in that lunge position, and once again, there are adaptations to doing lunges. They're actually chair lunges for people with limited mobility. So those would be the 2 main ones. But when I'm thinking about a resistance training program in general, I think that should be built off of movement patterns rather than muscle groupings. And so what I mean by that is like a lower body, like doing push and pulls. It's common in strength and conditioning. And I'm hoping that in disease management, we start designing protocols based on movement patterns as well, rather than muscle groupings, because I think the muscle groupings can be quite confusing. And so when we're being told to work all major muscle groups, technically, if I did a deadlift, every muscle group in my body is engaged in that one exercise. And then also, I think that there can be confusion in terms of what exercises work what muscle groups. Most people don't have formal training in resistance training principles. So if I'm doing a row and I don't know anything about resistance training, the only thing that's moving is my arm. So am I just working my arm? No, there's more to it than that. So if we're talking about movement patterns, I would design exercise programs based on the movement patterns. So like a lower body push would be a squat for any variation of the squat, any variation of a lunge. A lower body pull would be any type of deadlift variation. And so this is happening and both of these, they're all happening at the ankle joint, the knee joint, the hip joint. If we're talking about upper body, I would do a vertical movement like a press, a vertical push. And then a vertical pull would be like a lat pull down or a pull up or a modified pull up. A horizontal push would be any bench press or push up variation. And then a horizontal pull would be any row variation. So I hope that we get to the point where we're designing interventions for people with chronic conditions based on movement patterns instead of muscle groupings, because once again, that's going to translate more over to improvements, or it's likely to translate more to improvements in activities of daily living.
Yeah, makes sense. And maybe a little bit about the safety and effectiveness. How do you balance safety and effectiveness for individuals new to resistance training? And maybe also that you don't put too much effort on safety. Of course, in the beginning you need, but you need to be also kind of increasing the intensity and not staying just like that. This is definitely safe, but is it effective? Yeah.
Yeah, and it's always a balance, and I think it's often touted as one of the main differences between free weights and machine weights. And I don't necessarily think that, I mean, in all cases, I don't think that machine weights are safer than free weights, although I know I've heard that said. It comes down to the skill level of the individual. But if somebody's just starting off resistance training, I would say the most effective way is going to be primarily standing multi-joint free weight exercises. But if you don't have any training in resistance training and you're not going to have any supervision, then the machines make sense, right? As long as you go in and you can follow a picture on the side of the machine, you're going to be okay for the most part, I think. But yeah, and so when I work with people, like when I'm working in person with people nowadays, it's mainly my students. And when I'm teaching them the squat and I'm teaching them, I think it's important to make sure that when you're progressing them, that it becomes more of a conversation and a negotiation with the client more than me saying, all right, you're good, we're going to raise your intensity now. Because especially with the free weight exercises, there's that bit of fear when people first start lifting. Like, it's scary sometimes having this amount of weight on your back or over your chest and you're not used to it. And it takes a little time to develop that confidence. And so what I typically do is after I've watched a student do a repetition or do a set on the squat or the bench press, as long as their technique looked good, I'll say to them, I was like, your technique looks spot on. You could probably do a little more. What do you feel like doing? So we just have a discussion, and because it really comes down to providing an experience for them that they're going to internalize, and they're going to internalize the benefits and the confidence so that they can do it on their own.
Yeah, makes sense. And I will keep one question. What methods do you recommend for monitoring progress and adjusting programs based on individual responses? So how do you monitor basically easy enough, but still being that it makes sense?
So, like you're talking about, like when we're asking about monitoring progress, just keeping detailed logs of everything. So is that what you're asking, like about like how you're actually monitoring progress? Or yeah, so and we keep detailed logs of absolutely everything that they do in the warm-ups, in the warm-up and the actual training sessions, number of reps, sets, weights, the exercises they did, the rest period between sets, rest period between exercises, movement speeds, all of these. And also monitoring how the client's actually feeling, just keeping that dialogue going with them. And like I was saying earlier, when we're talking about increasing the intensity, I keep it as a conversation and kind of a negotiation with them. And especially in the early phases, you always have to be mindful and prepared to adjust that intensity if they're still learning. So yeah, does that answer your question?
Yeah,
Okay.
that does. So just basically logging, nothing more technical, just checking what's the weight, what's the repetition, and then seeing it. And let me see. Yeah, so how do you find the typical barriers that patients face? What are the kind of things that if you suggest people with type 2 diabetes strength training, what do they usually object to, and how do you effectively address those things?
Okay. Yeah, I already talked about some of the environmental barriers that they can face, and this was true with people with type 2 diabetes and people without type 2 diabetes. So, once again, back to having a higher BMI in a lot of patients with type 2 diabetes, they can find exercise really uncomfortable. maybe in those populations, starting them off doing some of the exercises from a seated position, which might be more comfortable for them. And they're likely going to have increased risk of pain in their joints and in their muscles because of the excess weight or because of other comorbidities like arthritis. That's one of the things that I've had to work with my dad I think I started doing this with my dad maybe right before COVID started, but he lives down in Louisiana. I'm still up in Michigan. And so I started doing virtual personal training sessions with him once a week. And when I first started doing it, I had all these great ideas of effective programming. I know how to make your balance better, how to improve your strength. But then when I started working with him, real world happens, right? Barriers happen. And like when we would get 6 reps into an air squat, he would start talking about how his arthritis was flaring up in his hips. So we had to transition to another exercise. So I think we really need to keep in mind the different comorbidities that they're likely to have and always have other exercises on the back burner of what you can substitute. You also have to consider, if we're talking about mental health again, depression is highly prevalent in people with type 2 diabetes. People that have depression, and it's bidirectional, people that have depression, they're more likely to develop type 2 diabetes. And part of that has to do with some depression medications actually can cause insulin resistance. And then you've also got people with type 2 diabetes, they're more likely to develop depression after diagnosis. So that's another consideration if we're talking about psychological barriers. But I think a lot of it is going to be trying to make the experience enjoyable for them and helping them develop that self-efficacy. And one way that you can keep them motivated, one of the things I really love about strength training is you get feedback on your progress within a few days. If your main goal is weight loss, that can take some time. But when you start strength training, if you're just starting off, the second time that you come in, the third time that you come in, your strength levels are likely going to be better than the first time. So constantly feeding that information back to the client. Hey, you went up 5 pounds on this bench press since last week. That's awesome. So reminding them of these achievements that they're making every time they come in, I think can be quite powerful.
Yeah, sounds good. And you said online coaching, your father, my parents are 70 plus, 75 close, and they go to gym maybe twice a week. And I think last 5 years, always my feedback, especially for my mother, has been like, yeah, put more weight. And I think saying it like for every week for 5 years, I think now she has the intensity there because like really careful and so on. And I'm like, yeah, just put more weight. And yeah. Nothing have happened, but the intensity have increased slowly. And now I think it's somewhere there.
That's good. Yeah. I used to personal train my mom whenever I lived down south, and I did take more of a drill sergeant approach. That wasn't very effective for my mom, so I had to learn that I needed to be a little more kind and back off my own intensity if I wanted her to keep coming.
Yeah, I just keep saying the same thing, and it's funny. Like they always, all right, yeah.